Welcome to the Rehab Roundup. I am your host, Dr. Hassan. I am a board-certified physiatrist and independent practice owner, helping physiatrists in their first 5 years out of residency build profitable practices so that they can maintain and obtain financial independence. To those of you all who are back from last week, thank you. Welcome back. To those of you who are new to the Rehab Roundup, thank you. Last week, we talked about CMS 13 and basically the diagnoses that 60% of the patients in your rehab hospital or your rehab unit have to fall within those 13 diagnostic categories. So I know what you're thinking. So that's 60%. What about that remaining 40%? So for that remaining 40%, what I like to do is be very strategic in terms of how I go out to the acute care hospitals and market, per se, to the specialist to kind of get patients who are rehab appropriate and who will benefit from our services. So those are patients like your post-CABG patients, post-valve replacement patients. So in those situations, what you do is you go to that CV unit, to that cardiac unit, cardiac ICU. You basically form bonds and relationships with the case managers on that floor, the nursing staff on that floor, nurse practitioners if the cardiothoracic surgeons kind of utilize them to kind of help care for the patients, and also the therapy teams on those floors to kind of say, hey, listen, if you have a patient who has some type of acute cardiac event, had to have a procedure, and they're not quite safe to go home, they may benefit from acute rehab. You also take that same philosophy in going to the ICU. You can get a lot of ICU critical illness, myopathy, polyneuropathy patients. You can utilize that strategy in kind of going to the nephrology service to get those chronic dialysis patients who may have a uremic myopathy or who may just be debilitated after acute hospitalization, who have end-stage renal disease and they're on hemodialysis. So these are some of the strategies that I try to employ to kind of be very strategic in how I assess patients and kind of transition them into acute rehab. So you have your 60%, Medicare says 60% of the patients in your acute care hospital or rehab unit have to fall within these 13 diagnoses. And then you have that 40%, which is debility, and that can be anyone and everyone. You can also go to your surgical services and say, hey, listen, if you have these patients who has some type of surgical procedure done and they're not quite progressing in a way that we thought they would have, and they're not quite safe to go home, then I think it would be beneficial to have a physiatrist come in, do a consult, and figure out what's the most appropriate level of care. Be that acute rehab, be that skilled nursing, be that home with home health or home with outpatient. But I believe having a physiatrist come in, lay their eyes on a patient, talk to the patient, talk to the therapy team to kind of really figure out what's most appropriate next step for this patient as they transition. What that does is it helps the hospital, helps the surgeons, because basically what you're doing is you're getting the right patient to the right level of care. What that does is it helps with throughput, helps with disposition and discharge planning, but what it also does is it helps get the patient to a level of care where they can get better and go home, and the hospital doesn't have to worry about a readmission. And it's also, if you think about it, it's quality of care. It's patient satisfaction. Because if you think about it, if you go into this acute care hospital, you have some type of acute event. And if you have a physician who's responsible for getting you to the right level of care, getting you better and getting you back home, you're really going to be very thankful to that hospital system and to that physician for providing you care from the time you hit the door to the time you hit the rehab to the time you go back home and you're back to life. So again, this is the 40% What's Your Rehab Diagnoses. I am your host, Dr. Hassan, board-certified physiatrist and independent practice owner, helping physiatrists in their first 5 years out of practice build profitable businesses so that they can obtain financial independence. Thank you for joining me again. You can follow me on social media at Dr. Hassan Rehab, DrHassassan Rehab. Thank you. See you next week.